case from. We're going back to our top story now. It's 8:10. The news that up to 1 million more people are now eligible for weight loss surgery on the NHS.
And joining us in the studio is Dr. Aseem Malhotra from Action on Sugar and Andy Reynolds, who has type 2 diabetes. Good to see both of you. Andy, let's start with you. It's been made very clear to you, hasn't it, that your condition is related to your weight. Is that something you're clear about?
Yeah, it's weight, it's diet, and in honesty, and at a certain point, inactivity from me. And
it's very, very pertinent to your worries and concerns because your mother lost her life, didn't she?
Yeah, unfortunately, she'd battled diabetes for quite some time, and eventually, due to poor circulation and smoking, which is always a bad thing with diabetes, not that it isn't anyway, but she unfortunately injured her foot. It got worse. Eventually they had to amputate the left leg, and it then went round to the right side, so they had to amputate below the knee on that one as well.
So with that horrible personal situation, has it made it possible for you to tackle some of your own health issues then?
I've kind of done the typical male thing of I don't feel ill, so I can't be ill, so I've kind of ignored it. For lack of a better term, I've put it on a back burner thinking I'll deal with it when I need to.
So hearing this news this morning then?
Yes.
Are you thinking this is something that could work for me?
It's something that could work for me, but I'm not necessarily saying that is the right choice for me. I mean, obviously with this sort of thing, it's going to be on a case-to-case situation, because obviously there's going to be some people that definitely need it, some people where other options might be a better choice.
Dr. Aseem, what was your reaction when you heard the news this morning that the NHS could potentially do this surgery for more than 1 million people?
Well, I don't think this is the right solution at all, to be honest. I think it's slightly ludicrous to expand gastric band surgery to so many more people. I think it has a role, but in extreme cases. And the problem with type 2 diabetes is a population-wide problem. You know, we have an epidemic of obesity in type 2 diabetes. And, you know, we're all vulnerable, if you like, to the processed food environment, and really where that we should be concentrating on. And this is where I think the Department of Health should really get off their backsides and regulate the food industry. We know that from recent nutritional surveys about the average Brit is consuming at least treble the amount of sugar that has been recommended as a limit by the World Health Organization. And part of that is because the food industry has been spiking our food with added sugar, a lot of hidden sugars in processed foods. We have given advice to Jeremy Hunt to say that what we need to do is really get the food industry to reduce by 40% added sugar in processed foods over the next 4 years. And according to the Department of Health, that would be enough to halt and possibly reverse the obesity epidemic. The other thing I must say as well, which is very important, is this isn't just about people being overweight or obese. About 1/5 to 1/3 of people with type 2 diabetes have a normal body mass index, and that is brought about by bad diet and potentially a little bit of lack of exercise. This can be, you know, this is a population problem. We're all vulnerable.
Tricky one, though, to deal with in the short term, isn't it? So, yes, pressure on the government to do something about the food industry. What about those who already have it, who can't, like Andy, change for whatever reason, you know, but there's a problem in you changing it? Is this a solution that will save us money?
Well, that's a very good question. So the first thing I would say is that actually what concerns me about this guidance is gastric weight loss surgery isn't without potential complications. About 1 in 20 will develop infections. We know about 1 in 35 will develop food intolerance associated with nausea, vomiting, bloating. What about the costs of follow-up appointments? Has this been factored in? We have a real problem with NHS resources at the moment. And if we're going to combat this type 2 diabetes epidemic, it's going to be through prevention. The other thing I would also add, which is very interesting, is that what people aren't aware of is even if you don't lose weight, and losing weight is difficult, and you know, and people should try and do their best to lose a bit of weight because it's important. But even if you don't lose weight, if you adopt certain dietary changes, in particular cutting out sugar and refined carbohydrates and eating more oily fish and olive oil and fruit and vegetables, you can reduce your risk of heart attack and stroke even within a few months, even if you've not lost weight. So what we need to be doing is promoting good, healthy diets for everybody.
So education on that. We've had lots of viewer feedback on this. Libby says if someone's lifestyle has induced diabetes, then rather than tackling this issue, them giving a surgery or a gastric band is just a quick fix. Patrick said it's all about diet, as you've just been saying. Gary says it's the easy option. Weight can be reduced by eating less and moving more. Just put less food in your mouth. I don't think it's necessarily that easy for you, though, is it, Andy?
It's a good point. I mean, not everyone's the same, you know. Again, I fully admit I'm probably not as active as I should be, and that is something that I have changed since the Motivation Nation, which was done previously. But it's It's a tough one to call, to be honest with you, because everyone's got their own particular issues, and it's not clear-cut in many cases. But in mine, yeah, I admit I could do more, and that is something I am looking at doing.
Good. That's good to hear, Andy. Thank you very much for joining us, and Dr. Aseem as well. Thank you for joining us too.